Hello, my name is Donna Curick and I'm the Director of Quality and Patient Safety here at OrthoVirginia. Today I'd like to demonstrate to you how to properly use and care for your mask. Now, there's different varieties of masks. This is a homemade cloth mask. You may have a store-bought mask or a medical grade mask. It doesn't matter which type of mask you have as long as you're wearing it snugly. So for this mask, I'm going to put the elastic around my ears, and then I'm going to place the fabric over my nose and then stretch it out so that it's got a nice covering over my nose and then comes as far down under my chin as necessary, okay, to be snug. Now, with the elastic, this is a little loose for me, so you might need to make adjustments on your elastic around your ears. Now, what I've found in some of the masks I've had, the elastic bands are actually a little bit tight and can cause irritation to the back of your ears, or may cause the mask to fall off, okay, by pulling at your ears. So if you have that, you can stretch that elastic out for and get it a little bit loose. But if that doesn't work, you can always take a hair tie and tie it through the current elastic and give you a little bit more length on that mask. Now, the outside of the mask is what we call the contaminated part, so you want to avoid that. Now, I don't know about you, but I find all the time, as soon as I put my mask on, my nose gets itchy or want to touch my face, okay? So you want to avoid doing that. But if you do touch your face, you want to immediately wash your hands afterwards. If you're not accessible to a sink, then what you want to do is apply a 60% alcohol-based hand sanitizer to clean your hands anytime you touch that mask. Now, what I've found when I've been out and seeing people is oftentimes I'll see people walking around with their masks like this and their nose is exposed, okay? Now, when we said that the outside is what we call the dirty part, so any particles or debris is getting stuck in there is sticking to your mask. So when your nose is open like this, you're actually breathing in that dirty part. So you don't want to do that. I've often seen people where they wear their masks like this, or they'll wear them under the chin, or sometimes on the head. Again, that outside is dirty, so any portion of that's touching is now becoming dirty, contaminated, and that's risk of exposure. Okay, so if you're in a position where you have to have your mask off of your nose or off of your mouth, it's best to just remove the mask and maintain your social distancing of a minimum of 6 feet. Now, some key cleaning things: if you have one of these cloth masks, you can put them right in the laundry, just like any other wash that you have. If you have a store-bought mask, what you want to do is make sure you change it anytime it becomes soiled and get a new one. If it's not soiled, usually you can wear it until you start seeing some wear there. As soon as you see wear, you need to change it. And that could be as early as 3 to 5 mask wears for some people who use them all the time, and that may be longer for others. Now, another thing is you don't want to share your mask with anybody. If you wash them and somebody has a clean mask, that's different, but you don't want to wear it and then 3 hours later somebody doesn't have a mask and you hand them your dirty mask. This is your mask and should stay for you. Another thing is with this mask, as you can see, these homemade masks, it's one color material, so it's very difficult to understand which is your outside versus your inside portion of the mask. You always want to make sure that the inside, which is the part touching your skin, is the same. Okay, so what I suggest doing is, if it's the same color, you can take a permanent marker, put some initials in here, or mark inside, something that reminds you that that's the part that goes across your face. Okay. Now, this is the basics of mask wearing. Our goal here at OrthoVirginia is for you to stay safe and stay healthy during this time. Take care and have a great day.